I think the NHS has to train people to be able to deal with multiple morbidities, because there is no one person today that comes up with one condition, and therefore every nurse, every doctor has to be able to treat all conditions. We have to be able to prevent, and we have to be able to treat conditions as they arise, and therefore we need right throughout the healthcare system, whether it's in prevention, whether it's in delivering acute care or community care or any tertiary services, we need everybody to recognise that they're often not treating just one condition. And I think some of the issues that we have in that is the way in which we train our professionals. So we spend a huge amount of money training nurses and doctors, and particularly doctors really, is they spend some time in training and they work as generalists, and then very quickly we specialise them. And early on in my career, I know that if you only train someone to do one thing or one set of things, it will be a problem, because actually we always used to say in the early days of management, if you train somebody just to do the mitral valve, then the rest of the body gets ignored. And therefore I think for the nursing profession, that all clinical professionals really, is we need a baseline of what everybody can treat, and then seek specialisms thereafter. I think it's a huge waste at the moment that we train doctors and then very early specialise them into conditions. You don't have somebody coming into orthopaedics, for instance, or it's very rare that you have an elderly person that hasn't broken their leg, plus have diabetes, plus have other conditions. And so for me, we need to adapt the training so that actually most of our workforce can deal with most of the things that they see. That's not negating the need for specialists, because we do need them in secondary and tertiary services, and we do need specialist opinions. But I think unless we have most of the workforce trained in a common way so that they can meet some of the common issues that our population face, we are on a hide into nothing. Well, probably the biggest challenge is there's not enough. And we know that particularly for the nursing profession, we only at the moment train 28 per 100,000 of our population. And thereafter, we rely on overseas nurses to fill our gaps. And we can no longer continue to do this. And yet we still need nurses trained to a very high standard. So it's not good enough for us to just say, well, let's just train other sorts of people, or let's just train other sorts of doctors, because actually you reap what you sow. And therefore we need to train all of our professionals to a very, very high standard, because that's the standard of care that our population gets. And so for me, we've got to stop relying on overseas nurses and increase our own domestic supply, and that is to a high standard of education. There is no point in this day and age in saying that we do not need nurses with a high quality of training, because we know that things have changed, information has increased, science has moved on. People need to understand the conditions that they are looking after. So it's just not good enough for us to sort of suddenly magic up a new syllabus that means that we train hundreds of people, and it's not even nearly enough really. So we do need to increase our domestic workforce supply. That means that we have to ensure that the profession works in an environment that is sustainable. For the first time ever, more people are leaving the nursing and midwifery register than ever before. And that is because we know that the system is unsustainable. People cannot do the job that they have been trained to do. So there is something about stabilising the system that we work in and then attracting people into our professions. And as I said previously, making sure that our training for everybody, that, you know, there is no point in training a physiotherapist and all of a sudden saying, well, we can use them to plug the gap for nursing. And they haven't had a common baseline training. So if we want to do that, change the training. Because then we know that we've got at least a level of training that people can veer off into different parts of the clinical professions. So if we are going to do that, then we need to do that properly. We can't just snatch physios or OTs and say they can suddenly manage nurses or they've got the experience and the knowledge. It just does not stack up. Obviously, the medical, clinical, nursing profession are global professions. So, of course, we can learn from all over the world. And certainly, if you look at any kind of medical law, it's global. I think there is an issue for us in particular in that we're trying to contain costs and actually we're individualising mistakes to people, and the sudden rise of gross negligence manslaughter is a big issue that will put people off. Having been a clinical director, I know that you can't have arguments with the profession on one hand saying keep the cost of clinical testing down, while on the other hand saying you've missed a glaring obvious condition. And so I think there are some issues that we as the professionals need to talk about that have been done to us. And I think that we are placing it in an emotive situation where we have the population responding in a particular way because they wouldn't they, unless we have a frank conversation. But I think one of the things that we can look right across the Western world for is some of the safe staffing. If you look at California, if you look at Australia, people are beginning to say that there is a need to have safe numbers of people looking after the population. And we know that if you're a vet, you can't look after certain animals without having the right numbers. Why can we not have this for our human population? So I think that we need some accountability into the system. We can't have it both ways all of the time. And there are huge challenges facing us. I think the professions will rise above those challenges if we can sustain the environment that people work in and start to make them attractive professions again.